Welcome everyone. Great to see so many here again. We are going to have the topic today is about clinics and the worthiness, the yikes, and the worthiness, the idea of having a multidisciplinary clinic for people with Prader-Willi syndrome. Not everybody would agree that they're a good idea, but I think most would support the concept. So we're going to have a short and then a case study from Marguerite. And today we're only having the one case study because towards the end of the session we're going to have some time to discuss how the next echoes might look, the ones that XY is hoping to plan in the near future. So I'm going to now introduce Georgina. Georgina Loughman has a long 20 years of service as an executive member of the Prader-Willi Syndrome Association of New South Wales, and a director of IPWSO. In these roles, Georgina has collaborated widely, contributing thousands of volunteer hours towards writing and publishing of family support worker and clinician educational materials regarding all aspects of Prader-Willi syndrome. Georgina's tertiary study is in the field of physiotherapy. However, her work with obese people has extended to include establishing the Prader-Willi syndrome specialist clinic under the Metabolism and Obesity services at the Royal Prince Alfred Hospital in New South Wales, Australia. This PWS clinic supports adolescents and adults, has been supporting them for over 25 years. Physical activity and nutrition for a healthy lifestyle. I now invite Georgina to give us a small presentation regarding the work she's doing at the Alfred Hospital.
Thanks, James. Okay, you say some people may not think multidisciplinary clinics are important, but for many years people would not call what we offered a clinic, but we call it that, and it's been good. Okay, so my presentation really just covers my own personal experience of working in our and I'm also including my thoughts about how it can be achieved elsewhere. Why is there a need for a PWS clinic? Well, I honestly believe that PWS, we know, is relatively rare disorder, but it's still occurring and it's not disappearing. We see probably about 3 to 5 new clients. We see probably about 3 to 5 new clients each year, and they range in age from 12 years now up into the, sometimes we see adults who have not been seen for many years since they attended a pediatric clinic. I honestly believe that, a knowledge of PWS is vital to offer holistic care. And I think that's what's so important, not just for the person with PWS, but for their families and for their caregivers. So yes, there are a limited number of experienced PWS clinicians. And I guess I'm in the position now where I'm really looking within a clinic, care clients and parents deserve knowledge and support, and they deserve knowledgeable support. So they deserve support for their young child or adult child with PWS that's based on sound PWS knowledge, because too many stories we hear about people seeing a doctor and they were misdiagnosed, or their fever wasn't discovered, or different things weren't found that should have been found, but often because they pertained more so to PWS and it wasn't fully understood. We all know that living with PWS is not easy, and we can't really get away. It's not easy for the person with PWS, and it's not easy for their parents. And support needs of someone with PWS continue far beyond childhood. So more readily we see clinics for children with PWS or services that provide PWS as a child, but clinics for adults are much rarer. So I believe that with good knowledge of PWS, we can nurture good health and certainly greater longevity. And I'll talk about that a little bit later. So what can a clinic provide? What can a clinic provide? Obviously, it's PWS orientated care. And by that, I mean that with a knowledge of PWS, you might have longer appointments. You know that the people with PWS can get upset. So we're prepared for the people with PWS can get upset. So we're prepared for what's going to happen besides just the medical care. Obviously, we provide an ongoing holistic medical care of the client. So it's not just that of an endocrinologist. Now, I'm not going to talk a great deal about pediatric clinics, but how do we get them started? Because most pediatric clinics that I know of are part of public hospitals and they are incorporated within the pediatric unit. So it may not be a specific clinic, but they might have a day a month where they see people with PWS. Whereas for adults or adolescents, it's a little bit different. And a lot of our clients have gone to pediatric clinics. In Sydney, there are 2. So they've gone to the pediatric clinic up until about school age. And then after school age, they go to school, and medical care and ongoing care tends to fall a little bit to the side. This is when sometimes the wheels can fall off. So allied health care is a very important part, as we know, of management of people with PWS. And again, this is a lifelong treatment for some allied health services, such as the role of the dietitian, physical therapist, occupational therapist. Now with our NDIS, we're seeing adults receiving treatment that they would have had as children, but only for a couple of years. So they're now revisiting those services. A clinic can also provide referrals to and PWS enhancement of other specialists involved in a person with PWS's care. And by that, I mean referring to the clinic itself may have just the endocrinologist or just the pediatrician and a dietitian and a physiotherapist. But for the sleep physician, the phlebotomist, the person who takes the blood, the psychiatrist, for bones, it's really good to build up their knowledge as well so that they know about the person they are treating. It's not just for the phlebotomist, it's not just an arm they're getting blood out of. They realise that, you know, the venous system is a little bit different. For the sleep physician to be prepared for difficult behaviour. It's so important for people behaviour. It's so important for people in a role where they're seeing people with PWS to share their knowledge and to encourage other specialists to start seeing them regularly. So what we do is we've identified different specialists over the year and we've referred to particular specialists within our hospital and outside our hospital, and then we with PWS. So they build up their knowledge as well and their expertise. Through our clinic, we've been able to develop particular PWS protocols. We now have a hospital admission policy for adults with or adolescents with PWS. We've also had an impact on the other protocols of PWS. We've also had an impact on the other protocols within the hospital, such as the different codes that are called Code Black when someone is violent and aggressive. The security are called, and sometimes the police, and they can be really handled in not a particularly good way. And we've had a few incidences, not many, it's 30 years next year since we started our clinic. And we've probably had 3 incidences that required a Code Black being called. But we were then able to talk to the security guys and explain what was going on. And at one stage they were going, that's just ridiculous, you know, we have a clinic here. And so we taught them what it was about and we explained what it was about. So then they'd sort of look for us when things were difficult. So it was good. Our PWS experience has certainly been shared with other professionals, obviously with trainees. We get a lot of visiting overseas doctors who always sit in on our clinic. We have dietetic students sit in. We have the trainee registrars and residents who are going through the endocrine system sitting in with us. And from the overseas doctors, we've now helped encourage them to manage people with PWS greater knowledge and a much greater interest. So that's mainly thinking of Singapore and China and Hong Kong at the moment. And of course, research. So not only can we do research ourselves, and I must say I'm guilty of not doing a lot of research because I just don't have the time. Connected Research Department does a lot of research now in PWS, and they're going to be involved in an exercise one fairly soon. Okay, so that's the basics, but what else can a clinic provide? It can provide a voice for the patient with PWS, and I say this most sincerely because we are PWS, and I say this most sincerely because we often see parents who are drowning in the care of their child with or adolescent with PWS. So we, I suppose, encourage parents to do what works to help their child achieve better health. We also provide an understanding and a support and guidance for parents and carers. So understanding that, yes, it's not easy living with someone with PWS, but also we support them to put in place strategies that will improve the health of their adolescent and child. And I'm not just talking about obesity, there are other, their adolescent and child. And I'm not just talking about obesity, there are other comorbidities that can occur as well. So we do a lot of training, and I'll come to that as well. We also take on the role, and any clinic can take on the role as an authority figure for the person with PWS. So this basically means it reduces the blame that goes towards parents and carers, so they can deflect to us and they just say, oh, but the clinic says you must do this, or the clinic says this is the best thing to have. So in the heat of the moment, parents can deflect to us and say, no, this is what, so they will contact me, the parent or carers, and we'll have a discussion, and then we'll talk to the person, and it just deflects a lot of that. On the other hand, it can also be something for the person with PWS to say, no, I can't have that. And we've had this at day programs. They'll complain to their carers about what's being served at the day program because they can't have that, so it's too hard for them to be around people who are having it. But it gives them an authority in the case that if they become unwell, we have clients who tend to abscond, and they've become very unwell and they've just said, take me to Prince Alfred Hospital, they understand what I've got. And so that's worked very well for this because they feel secure in the knowledge that at least we know what they're talking about. We've been able to develop PWS specific resources. So we have an eating guidelines and meal planning programs put together. We do a lot of PWS training, and I guess I'd have to say that quite a bit of my work in particular is going to schools or to service providers such as group homes or places of employment or day programs to train their staff. And obviously all this year to train their staff. And obviously all this year, or since about June, all of that's been done via Zoom. We also write loads of letters for our National Disability Insurance Scheme. We often advise funding bodies as well as the residential services. We present parents or carers who are going for guardianship. And we've also been involved with the police quite often, explaining what the situation is of our client. I've several times gone into the city when other clients have absconded, looking for them and discussing the situation with the police, the ambulance when they've brought clients in. We also have a voice for other specialists within the hospital who don't understand PWS, and we've had to fight for care for a couple of clients who have been brought in quite difficult states several times, and we've actually had people in quite difficult states several times, and we've actually had people say, is it really worth fighting, you know, is it really worth working on this person still? And so we've been a voice for their longevity, for their life sometimes. We also have, which I think is really good, and it can only happen if you have a few professionals of the one field. We give the person with PWS a choice of the medico they see. So if for some reason they don't like the medico after a little while, we'll say, okay, well, you can see somebody else, and it's all still within the clinic. So how do you get a clinic started? Well, As a parent, I would say you find an interested or a willing doctor. And this, I think we have to be quite bold with our knowledge, and we have to be bold for the sake of our people with PWS. So if you can find just one interested endocrinologist or pediatrician who will see your child, adolescent or adult, and then you encourage other families from the same region to go to that same doctor, and then you bombard them with reputable information about Prader-Willi syndrome. There's lots of reputable information on the PWS, on the IPSO site, and possibly on your country sites, using the information and the summaries that have been put out by the CSAB of IPSO. There's one for children, one for adolescents, one for adults. And then encourage, as I said, other clients to see the same professional. To be getting started as a clinician, well, we started with just one patient. We were a metabolism and obesity service, as James mentioned, and we still are. But we were asked to see adults with PWS because they were living longer, which was fabulous, and they were now too old to go. Consulted with our geneticist who started us, asked us to see people. And I think it's important for clinicians, pediatrician or endocrinologists, and it's probably, pediatricians are probably would anyway, but endos not so much. But they need to consult with geneticists, other clinicians, and with geneticists, other clinicians. And I'd really encourage, and it's a difficult thing because sometimes medicos are not real keen to look up information, but give them lots of literature and invite them to conferences that are on, and also all the information that is on IPSO. We invited the service of an allied health person, just one session a month. So this was just for 4 hours a month is how we started. And then because we started to see more patients through communicating with the PWS parent organisation, we needed to have more time, and communicating with the PWS parent organisation, we needed to have more time and more time. And it went from going to one session a month to us seeing now probably 5 people a week, maybe more each week. And the important thing is, as a clinician, to attend PWS conferences. Because really, I would have to say, attending those conferences it awakens something within you. And it's not just me. I know of other clinicians who've gone along thinking, oh, yeah, and overwhelmed by the desire to keep working with PWS. So I think if we can get them to conferences, there's one foot in the door. We need to support the need for clinics. We don't have, I know the big thing is about funding, and I spoke with Lara from the Netherlands yesterday, and asked, because she set up a new clinic in about 2015, and I said, were you funded for the clinic? Oh yes, we received funding for it. I've visited one of our states several times trying to encourage them to start an adult clinic. Oh, but we haven't got the funding. We didn't wait for additional funding. We just stayed patient. And we started small. And I think we have to realise there is a need for clinics. It's not going to go away, but you must be prepared to learn. The clinicians must be prepared to learn. They must develop an alertness to the associated medical conditions that can go with PWS, and they must have a full understanding of how people with PWS think and how they respond. Because we have to be very aware that when we are seeing clients, you don't want to incite any increased anxiety in them, because the person who's brought them to your clinic has to get them home in the car, and sometimes they travel a long way, and if they're angry, lots of things can happen. Lots of things can happen. We have to advocate for the client's right to good health services, and that will only happen by parents and, I think, professionals standing together and demanding that the services that are ideally in a public hospital, so that there are no charges for the client or the parents. So our clinic started in 1991. We started with one patient for 12 months, and then by the end of the first 5 years, we had 8 clients. we have a roughly even split. We have 56 females and 52 males. They're now aged from 12 to 64 years. And currently we have 20 people over the age of 40 years, including 7 over the age of 50 and 2 over the age of 60. Our clients attend regularly, and we now have 53 people attending regularly, and that can be anywhere from monthly attendance. And of course, a lot of that is done by telephone or video now. But if they're really obese, their carers or parents providing an appropriate environment and they're struggling, so I will see them monthly. The doctors will probably see them every 2 months to start with, then that will go 3 monthly. And the patients who are doing really well, we might just see 6 monthly, but we make a point of bring them in every 6 months, all the adults as well, to have blood tests just to check that everything's going well. There's a lot of telephoning and emailing and of course video contact now with our out of area patients. So we don't just see patients who live in our local health district, we see patients and I've certainly consulted with patients in other parts of Australia as well. So just talking about the other parts of Australia. Oh, my other part's not turned. Oh yes, here we go. So as you can see, Australia is a very large area. We have a population of just over 25,500 people, but our land area is 7.7 million square kilometres. And at the moment we have a paediatric clinic in Victoria, we have a paediatric clinic in Queensland, and we have 2 paediatric clinics in Queensland, and we have 2 paediatric clinics in 2 pediatric clinics in New South Wales. We have 1 adult clinic in South Australia, which I think is still in existence. We certainly have a newish, about 5, and we have the 1 adult clinic in Sydney. We have 2 pediatric clinics in Sydney as well. So for this huge land space, plus 25,500 people, they are not really being serviced particularly well by clinics. And there are a lot of country doctors who might see a patient and then clinics. And there are a lot of country doctors who might see a patient and then they'll refer them to us, or we'll do lots of telephoning with patients. We've consulted with patients in Tasmania several times, and the Tasmanian patients actually have to go to Victoria to be seen in the paediatrics. So Victoria has not got an adult clinic, despite discussions over probably 12 years about setting one up, but it still hasn't happened. Okay, so the negatives of our clinic is we're in a large public hospital. There's lots of people. There's waiting rooms with other clinics because we don't always run on time, because we don't believe in fitting the consults in exactly to half an hour for follow-up. If patients need to talk more, we talk more. There's food around. We've learnt many lessons about the there's like a fridge room in the department, so that's always can be a source of problem for some of the guys with PWS, although most people know when there's someone with PWS in the clinic now. The codes, as I mentioned before, we have to battle with the hospital codes and allowing violent people into the hospital. We have very inexperienced emergency staff, so this was partly why we developed a policy. But now when anyone comes into emergency, we go down and we meet with them and speak to the staff and explain to them about PWS. We don't have a designated psychiatrist, but we have one world-renowned for his knowledge in PWS, but unfortunately is retiring soonish. We had to change our clinical space, so that was a bit of a blow for some of the guys, and we've lost our big room. We used to have groups every 3 months where everybody got together. The carers and parents were in one room and all the clients were in the other, so it was a big information sharing, problem solving session, which was fabulous. Sometimes there's disruption to other clinics because some of our guys get very excited when they've done well and everybody in the whole department knows about it. And despite having trouble with some of the other heads of departments, we've had damage to equipment. not actually within our clinic, but certainly within the hospital. But the positives, we have on-site services. So we have the dietitian, the physio, and the doctors on site. We have the people who take the blood, phlebotomy, respiratory clinic on site. That's all upstairs. So it's all in the same building. And now PWS is pretty well known within our hospital. The patients themselves are fabulous at waiting now. They don't get so tense because they know that if they're going to see Tanya, she'll probably run over time, so they might have to wait a little while. If they're going to see Tanya, she'll probably run over time, so they might have to wait a little while. So their coping abilities have improved greatly. The patients have this affiliation with the clinic. It's their clinic, and they love to see other people with PWS there, but they also know that they're seeing people who know about it. There's an increased PWS awareness within the whole hospital, as I mentioned. We've adapted our clinic to, what shall I say, to the rules of the hospital. I think really the rules have adapted to our clinic more than anything. And we have an improved environment. When there's people with PWS, there are certain doors that are immediately shut by our clinic next door to us, where food is often on the table, so they're very aware of that. A few years ago, we asked our parents and carers what they thought the benefit of coming to disciplinary clinic was. And this was basically their result. Almost 90% of them said the ongoing support, they could keep coming all the time. Specialist care, training for other people about PWS, so helping the service providers of their children or adults. And at that time, we had a group program. So what helps a clinic? Supportive management within the hospital and supportive management within the immediate discipline range, so the clinic itself. A flexible job description. I've been able to turn my job into basically anything that I wanted to do, that provided it was work, which has really, we also provide a service for other people with intellectual disabilities, an obesity service, which I run, but PWS comes first and they're always booked in first. We step outside the square. We've certainly outside the hospital clinic for clients, as I said, in the streets. You know, sometimes we'll consult down in the car park if the client's having a bad day and doesn't want to come in, or we'll consult out the front of the hospital. And yes, I've had lots of dealings with police in different parts of Sydney about our clients. We have very regular contact with police. They can contact us outside work hours. They have most of our phone numbers, which is very good, the doctors and my own. There's certainly having access to the resources from IPWSO and also the local country, Australia PWS Association. Seeing the improved health and the happiness that comes with consistent care, consistent management, and consistent management that comes from training of caregivers that not just we do, but the parents do as well, and we do it collaboratively. And seeing the longevity of the clients really just makes everything we do worthwhile. It's really important to nurture other clinicians because we don't live forever and we need other people to come on board. And it certainly helps to be passionate about the people that we see, and that certainly helps to be passionate about the people that we see, and that's certainly evident in our clinic. And I think most people who work with people with PWS do so because they're passionate about them. So this is just obviously Sydney Harbour Bridge where I live, but I think what we need to aim is gap between not enough PWS services. And if it's an integrated clinic, well and good, or if it's someone who can refer to people who know about PWS, that can work just as well. It took 110 years from the idea of building this bridge to actually completing it because people thought it was all too hard. You know,